Effective therapy requires an immense amount of vulnerability. Before any clinical work can actually begin, a student has to believe they are in a room where they are safe, seen, and understood. But across K-12 education, marginalized students run into a systemic vacuum. Black, Hispanic, AAPI, immigrant, and LGBTQ+ youth are frequently matched with school therapists who do not share their background or their lived cultural context. This creates an immediate psychological burden, known as code switching. Instead of letting their guard down, the student often feels the need to actively filter their vocabulary, adjust their tone, and suppress parts of their identity to make the adult comfortable. Imagine the exhaustion of a teenager trying to process community violence, the stress of an immigration process, or historical trauma with a clinician who views the world through a dominant cultural lens. They have to explain their context before they can even begin to explain their pain. This constant friction builds an invisible wall. When a student is forced to translate their culture for their provider, the clinical trust needed for healing becomes nearly impossible to establish. This graph demonstrates the reality of representation. When students see themselves reflected in their therapist, engagement rises and dropout rates fall. MentalSpace School analyzes a community's specific makeup, assigning dedicated, intentionally diverse therapist teams to match it. In this model, cultural competency is a lived understanding of a student's specific racial stress and identity development. It is the core practice of the clinician, replacing the outdated standard of asking staff to complete a one-time diversity training module. That competency extends to linguistic accessibility. Families interact with therapists who are fluent in Spanish, Haitian Creole, and other native languages, ensuring parents and guardians are fully integrated into the support system without relying on third-party translators. By matching the student's lived experience, true cultural competency acts as a psychological bypass. It removes the translation barrier, allowing therapeutic healing to begin the minute the session starts. Getting the identity equation right solves the psychological disconnect, but it competes against two operational barriers: the friction of time and the friction of cost. When a student finally breaks through their hesitation and asks for help, making them wait days or weeks for an appointment puts them in clinical danger. MentalSpace School utilizes same-day crisis assessments to capture that momentum immediately. They deliver this care through a secure, HIPAA and FERPA-compliant tele-therapy infrastructure. This bypasses the geographic limitations of the physical school building, connecting the student to their matched therapist instantly. Simultaneously, the financial model removes systemic blocks for marginalized families. Services are integrated with major Georgia insurance networks, and Medicaid patients carry a balance of exactly $0. A culturally competent therapist cannot help a student who is locked out by an out-of-network bill or a month-long waitlist. MentalSpace School dismantles those systemic barriers so the clinical connection can actually happen. This bar chart displays the specific, measurable outcomes generated when trust is engineered and operational friction is removed. An 89% improvement in attendance, a 92% reduction in anxiety, and an 85% family satisfaction rate. The institutional benefits scale across the entire district. Partnering Georgia schools receives built-in staff wellness counseling and secure the necessary compliance support to meet the state's upcoming July 2026 HB 268 mandates. For school administrators focused on equity, culturally competent care serves as the necessary infrastructure for student success. Effective K-12 therapy relies on a very simple premise. A student must be intuitively understood before they even begin to speak about their trauma. MentalSpace School builds the teams that make that possible. Partner with them today to install this mental health infrastructure in your district.